I'm Dr. Steve Stites, Chief Medical Officer here at the University of Kansas Health System. We called this news conference in response to media inquiries about public health and safety with the snow and cold that is descending and about to descend on us. In studio are Dr. Julia Slater, plastic surgeon and medical director of the Burnett Burn Center, Dr. Michael Lewis, medical director, pediatric intensive care and the pediatric units, Dr. Travis Love, cardiologist, and Dr. Carrie Winnicke, clinical service chief and chair of obstetrics and gynecology. Joining us virtually from the emergency department, well, actually, I think she's right here, is Dr. Michelle Wilson, and we'll hear from virtual Dr. Jessica Callender-Rich, who's one of our gerontologists, and Dr. Jeff Holzberlein, physician-in-chief of the University of Kansas Cancer Center. The weather event ahead poses a real threat to public safety. It's a bigger risk for some folks more than others, which is why we have assembled this distinguished panel. We'll start with each physician offering words of caution for different patient populations, and then we'll answer media questions. When I call on you, please say your name and the media organization you represent. After this news conference, there will be no further opportunities for comment as we actually care for our patients. If something happens that media needs to know to alert the public, we will reach out. Now, I'm going to start. You may or may not know that I'm a pulmonologist who specializes in treating patients with cystic fibrosis, and kind of a goofy pulmonologist at that. The frigid temperatures pose a challenge for all people with breathing issues, and this cold, healthy people are going to feel it too. Sunday and Monday are going to be the days we expect to start seeing cold weather injuries related to the cold conditions, the wind, and the cold, wet snow. I want to bring in Dr. Julia Slater to explain and talk about the risk of frostbite. We don't have to be outside very long on a cold weather day to suffer from frostbite. Talk to us a little bit about the risks around that, especially as you see this weather coming in. And just to say it, it's been kind of a warm winter, so I'm not sure we're fully prepared right here for what's about to hit us.
Yeah, I think it's been incredibly warm so far this winter. And just as you mentioned, Dr. Stites, it's going to be really cold this weekend. The meteorologists are forecasting that it's probably going to be a wind chill in the negative teens for a lot of the weekend and even up into the negative 20s by Sunday night. And that's where we really get concerned. As you hit that negative 20 degree Fahrenheit, that's where you've got 30 minutes or less before you can start to form frostbite in your tissues. I'm going to be most concerned about anybody who's outside for a prolonged period of time, anyone who already has issues with circulation to their hands and their feet, so our diabetics, people that have had previous strokes or other medical conditions, anybody that might have drugs or alcohol in their system that can also interfere with your circulation. If you get outside, you start to have pain in your hands or your feet, get inside, get warm, and stay warm. What you don't want to do is go back outside and get cold again, because that causes more damage to the tissue. If any blisters develop, that's where you got to really be concerned that you have grade 2 or higher frostbite and you need to seek help immediately.
Yeah, we don't want to see that because we call that the Miami Dolphin game, right? That was kind of what we ran into a little bit around that. Now, Dr. Lewis, kids are going to see this storm as a big, big chance to go out and play outside. Let's, what's that song? I want to build a snowman. I won't sing that anymore. And go sledding. By the way, which one is your favorite activity? I'll tell you mine. You tell me yours.
Sledding.
Yeah, sledding's pretty good out there. I kind of like that. I miss my kids being young, I think. Okay, so what is your advice on playing in the snow with the frigid temperatures out there?
Yeah, absolutely. You know, one of the things that folks don't typically remember is that kids have, the way that their bodies are just shaped, they have what we call more body surface area than what we do as adults. And as a result of what that is they can lose heat much faster than what an adult can. So if you're going outside, even with your kid to go playing, they need to have an extra layer. I think a lot of times people forget that big, huge, thick layers are probably not going to be as effective as multiple thin layers, and so more layers that are thinner as opposed to one big, huge layer is one of those situations. And then really, you need to probably limit to about 15, 20 minutes if you can at a time. Once it kind of varies where we talk about 20 degrees, 15 degrees, just as a whole of like where would you maybe want to start to limit that. I don't understand why we wouldn't just want to be cautious with our kids anyways. 15 minutes at about 15 degrees is what I always kind of tell folks, and I think it's kind of an easy way to go about it. And then as the wind chill keeps going down farther and further, that's not even enjoyable to be outside, so I don't think anybody's looking for any like trophies and stuff. Just be cautious because it is very real. when one of those little kids has an injury to the finger or something like that, when they get a little bit of frostbite or to their nose and ears and stuff.
I love that minutes and temperature equality thing. That's pretty good. Yeah, make sure we keep telling our folks out there to remember that. All right, I want to talk flu for just a second. Now, our adult patient population is still high in influenza, but it is trending in the right direction. We're off the hook around the surgeries we're able to do those, et cetera. But we are seeing an uptake in our inpatient kiddos. Now, Michael, is that all flu? Is it RSV? What exactly is that?
We've seen definitely a lot of flu, a lot of RSV, some flu A and flu B, more flu A than flu B. But the reality is there's been a significant number of mini viruses out there right now, whether it's rhinovirus, older versions of coronavirus, not SARS-CoV. And so any of these viruses, there's been a huge uptake in that. And so a lot of hand hygiene, please, because they're all very easily passed on from one to another.
All right, now Dr. Winicky, are your patients at risk during a cold weather event like this? What advice are you going to give to our expectant moms, especially those who may be delivering pretty soon?
Well, I think we've got a few things. You've heard some great advice just for general recommendations, and a pregnant patient would be no different. Great weekend just to stay inside. We also know that sometimes we hear this layering is important. Might be more difficult for pregnant patients, perhaps don't have all those layers that they used to be able to layer in 6-8 months ago. And then, once you go outside, it isn't expected to be a lot of ice this weekend, but we do see some of that change of center of gravity when you're pregnant. We see a lot of falls. So please, if you do need to go outside, please be careful. Watch your footing. For those people who might have an appointment or something scheduled that's related to your pregnancy, highly encouraged to reach out, talk to your physician today. Do I need to go? Can I reschedule? These sorts of things. If you are experiencing symptoms that you think might be labor or needed to come in for labor and delivery, give yourself some extra time. Sometimes those symptoms can escalate really quickly, puts a lot of pressure on to get here quickly, and so just start thinking ahead, maybe come in, head into your doctor or to your hospital a few minutes early, and just great weekend to stay inside.
That's probably great advice. And just even driving and pregnant when you're out there in this kind of weather, I got to be a little careful. Seatbelt on, all that, right?
Exactly. And give yourself time.
All right. Now, once the snow falls, people will start grabbing their shovels to dig their way out. Dr. Love's a cardiologist, and just to tell you, I used to live up in Rochester, New York, and we always knew that this time of the year was a little challenging. When the first snow fell, we started seeing people come in with chest pain and angina. I think you're going to probably say the same thing about the weather event we're ready to face.
Yeah, absolutely. I mean, just to kind of reiterate what you guys said, we're dealing with two events here. One is the cold weather, which is important to recognize, but the other event is the snow, and people are going to absolutely reach for snow shovels, get out there, work on snow removal. I would just advise to stay inside right now and really just try to ride this out, be prepared for the event as it comes through. If you do have to go out and shovel some snow so you can get out and go do some things, just try not to exert yourself more than what you normally would. That's where the real problem comes, is people don't do a lot of exertion throughout the year, and then snow removal time comes and they exert themselves way more than they normally do. So go out, take frequent breaks, come back inside, warm up, don't try to do the whole driveway at once. Obviously be careful of ice and falls. When we talk about the cold weather and heart artery disease and peripheral arterial disease, you really have to be careful about being out in cold weather for a long period of time. There is increased risk of cardiovascular events as the temperature continues to drop, especially 0 and below. Your body just becomes more capable of forming blood clots, and that can lead to heart attack as well. So careful on the exertion with shoveling, but also careful out in the cold.
Yeah, I think that's a really great advice, because we know that shoveling snow could be a precursor to a heart attack if you're at risk. So what type of symptoms did people look out for while they're shoveling to make them think, this may not have been the best plan?
Yeah, absolutely. So you need to be looking for shortness of breath. So obviously when it's really cold, you're going to feel a little short of breath already when you're out there. But really pay attention. If you're feeling more shortness of breath as you're exerting yourself than what you're used to, it's time to take a break. Chest pain, chest pressure, also very important to pay attention to. You really need to, for lack of a better term here, listen to your body. Things don't always present like you think they should. Some sort of crushing chest discomfort or feeling like an elephant sitting on your chest is not always how people present with angina or heart attack. It can be neck pain, jaw pain. You could feel like your stomach's a little upset. So just pay really close attention to your symptoms in those times of exertion.
I think that whole point about if you feel different, don't think it's just because you're shoveling the snow. It could be something more than that, and so be careful around that.
Absolutely, just really pay attention.
All right, so despite all of our best intentions and our great advice, the emergency department is likely going to see a little increased activity from the weather. Joining us from the ED is Dr. Michelle Wilson. Michelle, what are we expecting in the emergency room with the snow and cold, and how do you staff for these kind of events?
So we still expect to see our regular emergencies like strokes and heart attacks. Medical emergencies don't pause for bad weather, but there are some presentations we expect to see more of. That includes falls from slipping outside, resulting in fractures and head injuries, cold exposure injuries like frostbite and hypothermia, car accidents given the bad road conditions, heart attacks and back injuries from shoveling, and carbon monoxide poisoning from unsafe heater use. So we're hoping our community will stay safe by staying inside, but if you have to go outside, layer up and wear footwear with good traction. Avoid driving, but if you have to, make sure you're taking it slow and have cold weather gear with you in case you get stuck. And then avoid carbon monoxide poisoning by using heaters correctly. Using grills, generators, or propane heat sources indoors can result in that, as well as running your car in a closed garage. And if you have to shovel, take breaks. As for staffing, we are staffed as usual. We're a 24/7, 365-day department, and we're always ready and available for our patients. And actually, it tends to be the day after a storm that we're most busy because people wait to come in. But sometimes patients wait too long. So if you're having chest pain, trouble breathing, unilateral weakness, confusion, or sustain a head injury, we still want to see you promptly.
You know, I was going to say 911 still works even in cold weather, and we're just trying to get our folks to be really comfortable out there. So the young and old are most vulnerable in an extreme weather event. Dr. Jessica Callender-Rich joins us with a recap of conversations she's having with her senior patients and some words of wisdom. Dr. Callender-Rich, what reminders do you have for our seniors to get through the next few days safely?
Yeah, I think what's important to remember is that as we get older, our bodies don't really compensate the same way for the changes in weather. And so it may be harder to feel the cold, and it may be harder to sort of compensate for the cold. And that means I would just reiterate, staying inside is really important. And you know, the shoes. If you have to go outside, wear good shoes, but the mail is not that important. So we see so many times people leaving their house to go get the mail or the paper. It's really just not that important. Let it wait a couple days until it warms up, until it's safer, until you have all the resources. Also, I would encourage people out there to check on their loved ones, make sure their heat is working, make sure they have all the things that they need, really so we can help people weather the storm in the safest way possible.
Okay, so I've known Dr. Callender-Rich for a long time, so I usually just say JKR. But JKR, I may qualify for being a little older now at this point. What I'm hearing is that I don't have to shovel the snow because I have a low back problem. I have to be careful with my balance, and I'm getting out of all sorts of stuff. This is a good conversation. Okay, cancer.
This is a really great time to rely on those neighbors to shovel your snow. Do it.
Excellent idea. I'm going to see if that works. And I'll just hang out in front of the fireplace with my cat and sip on a little coffee and tell my wife that I'm following doctor's orders. All right, cancer patients are another vulnerable population during a cold weather event. Our physician-in-chief at the University of Kansas Cancer Center is with us this morning, and he wanted to share this message for folks who are worried about whether to brave the cold and slick roads to receive their treatments.
You know, the first thing I want people to know is be safe, right? Use good judgment when you're making a decision on whether to come for your appointment, for your treatment, whatever that may be. If the roads aren't safe, stay at home. Contact your provider. We'll work it out. We'll make sure you still get the treatment that you need. Please do not put yourself or anyone else at risk by driving when you shouldn't be driving.
What about people who are, you know, in more fragile state, trying to do things like shoveling snow, the extra stuff that sometimes comes with these weather events?
Yeah, you know, I think that's something that we don't always think about. When you're undergoing treatment, a lot of things happen to our bodies and a lot of things change, and things that you might have been able to do in the past, maybe give that a second thought, right? And maybe ask a neighbor for help, or if you're able to help a neighbor. But, you know, be careful, and again, be smart. Don't go out and shovel snow if you're going to fall, or if it's too cold. Let that snow sit. It will still be there the next day, and again, we want you to be safe.
All right, that's really good advice. I just want to give one more piece of advice we haven't said. To those of you with chronic obstructive lung disease, asthma, COPD, or emphysema, this can be a really challenging time because cold weather does funny things to your airways. So just remember, be thoughtful, be safe. If you are going to have to go outside, if you got to take your albuterol inhaler with you, make sure you're doing your normal breathing treatments. Don't neglect those in this cold weather. I want to open up the lines for any questions, any people and reporters who may have questions. Let's please remember to say your name and the media organization that you represent. Jessica Lovell is in the studio, and she's been monitoring the chat threads for other reporter and community questions. First, the line for the media. Any questions? All right, not hearing any. I'm going to turn to Jessica now. Jessica, what do we got out there?
The first question, Dr. Stites, is from Donna. She says, my mother-in-law relies on medical equipment. What should we do to prepare?
Oh, that is a great question. First of all, I'm going to answer it from a pulmonary standpoint, and Dr. Calendar Rich can help me answer that with some of our elderly patients as well. From a lung standpoint, a lot of people are dependent on home oxygen therapy. Hopefully, you've gotten your paperwork completed so that the power and light company knows that you have to have that your power in order to power that oxygen tank or your home concentrators, etc. So if you don't have that, you do need a backup plan. And that backup plan can include family and maybe even going to their home in advance or friends, etc. I would also advise our general folks out there to look for shelters. Many churches and shelters have expanded hours and expanded capacity during cold weather events. Be safe by knowing knowledge is power in this situation. Have a plan ready. Dr. Calendar Rich, other thoughts you may have?
Yeah, I would agree. Making sure that we have our support systems really engaged to make sure that if we need help, the help can be made readily available. And I would add caregiver support. So there's equipment and there's people, and really making sure that we have backup caregiver support and plan for those people that really need someone to be at home with them all the time. And that might include having to go to someone's house or having to set up shift changes in ways that might require a little creativity.
Dr. Wilson, I know we probably get patients in our emergency room because they may dial 911 if they're short of breath, and the fire department or the ambulance may take them to the nearest emergency room.
That's right. Yeah, we still want you calling 911 if you have a medical emergency. Sometimes patients wait too long because they're concerned about the weather, but if you're having chest pain, trouble breathing, confusion, concern for exposure to carbon monoxide, unilateral weakness, or sustain a head injury, we still want you using the ambulance. On the other hand, if you've been having symptoms of something that have been going on for months to a year, probably not the best weekend to use an ambulance crew and put them at risk on the roads trying to get you to the ED.
All right, Jessica, back to you.
Dr. Stites, Jill wants to know if the hospital is making plans for staff. Do they have accommodations?
You know, we do have a cold weather plan, and interestingly, we have a plan where our staff can come in early. We have places where they can stay. We have places where they can go, and we have food. We have different things. So we actually do accommodate this for our staff, our physicians, and everyone when we face this type of event that our teams pull together in a beautiful way. And to be honest with you, when we really have cold weather events, we're ready, and our staff are ready. So let's go. Bring it on.
Angie wants to know how important is drinking water during an event like these. Is it okay if it's just tea or something hot?
Oh, that's a great question. Let's talk about this both in pediatrics and in adults. I'm going to start with you, Dr. Wilson. Dr. Wilson. Good Lord. Michael Lewis. Dr. Lewis.
As I'm
drinking water, you're hydrating.
Yeah.
I know, that was on point. No, in all honesty, it's one of the big things that's really important for us is as kids, especially if they're ill at this time of year too, like they kind of need to be a little bit more extra hydrated as well. And with kind of the surge and all of the less than healthy energy drinks and things that are caffeinated that might actually act as a diuretic, we really are pretty big on pushing fluids so that way they'll be more healthy.
And Dr. Winnicke, I'm thinking in our pregnant patients, that's a big deal because you got to take not care of just yourself, but also that baby.
Mm-hmm. Right, and so hydration is key and probably even more important in this situation with the pregnancy. So same things apply that we've heard from the other groups. Highly recommend staying hydrated. Water is always that best one. If you come inside and need a little bit of tea or hot chocolate to warm up, certainly is okay, but that shouldn't be your only way of hydrating throughout this cold spell.
And I think, Dr. Wilson, that people will forget that when it's dry and cold, your body loses a lot of moisture. It's even more important to emphasize hydration.
Absolutely, yeah. We see a lot of dehydration in the ED, and you are at increased risk with the cold weather and losing that hydration. So drink that water.
All right, Jess.
Jerry wants to know when someone should go to the ED versus going to the doctor or maybe urgent care.
Okay, I'm picking on you a lot right now.
That's okay. So yeah, we do get concerned that patients will wait too long to come to the ED during these cold weather events because they want to avoid being out on the roads, appropriately so. But if you're having chest pain, confusion, unilateral weakness, trouble breathing, those are times we still want you to seek care promptly. On the other hand, if you've had symptoms that have been going on for months to years, those can probably wait for your doctor's office or urgent care after the storm is over.
So, you know, we talk a lot about frostbite and knowing what are the times when you got to go get help more rapidly as opposed to trying to say, oh, I'm just going to put my hands over the fire.
Yeah, absolutely. So when you see blistering as you start to warm up your hands or your feet, that's where you know that you've gotten further damage and skin is actually breaking down from the ice crystals. That's when you need to get to the emergency department. Preferably, if the conditions are not too bad, you want to get to an emergency department like ours that's affiliated with our burn center. We have 24/7 staffing, and we partner with our interventional radiology team to get treatments that can save your fingers and your toes from getting full thickness necrosis or dying and having to be amputated.
And Dr. Kaldridge, I'm thinking that in the elderly, that curve from being okay to dropping off can happen really rapidly. What advice can you give to our patients to recognize those warning signs early?
So first of all, prevention. We really want to prevent anyone from having to watch for the warning signs by really staying out of the cold as much as possible. And I mentioned that we may not feel things the same way as we age, whether it's from vascular disease or just from parts of normal aging. So I would say anytime, even we're having those beginning symptoms, any kind of pain from the cold, that's the time to go in. Do not risk any of this.
Jessica, we're back to you.
Jonna wants to know what health conditions put people at the greatest risk in extreme cold.
Well, I think that's a great question. I'm going to take a first swing at that, and I'm just going to ask our panel to kind of to chime in here because you heard some of it. But I think it's those who have chronic health conditions, which can do a couple of things. First of all, it can put you at greater risk for having some problems if you have like chronic lung disease and you have bad lung function. You're not going to tolerate changes very well. Or if you're less mobile and you think, I'm not going to keep my drinking up because I don't want to have to go to the bathroom so often. Or you already have vascular disease and going out in the cold weather is going to cause challenges. Or you're a really small infant and you can't tell the world that you're hungry or cold, especially beyond crying. So those are some of the ideas I would think about. Dr. Lewis, thoughts you have, especially for our very young?
Yeah, no, it's a great question. And the reality is as you pointed out, anything that's like a chronic condition, I'm like, absolutely. I also think it's important too that as we know that if not just cold, but as we have like bad roads and some of that's going to come into play, take a look today. Do you have your medications that you're going to need for the upcoming next multiple days? Not every time is all pharmacies going to necessarily have their doors open that you would expect. And if you don't have your medications and you have that chronic condition like asthma, and you don't have your albuterol inhaler and you forgot to get a refill, it's really challenging sometimes to go get that albuterol inhaler, and I think that then puts you in a tough spot. Do you now have to go to the emergency room because we didn't think a little bit ahead? So kind of blends on what Dr. Kaldridge said, prevention, and sometimes that prevention is just thinking ahead. Do I have my supplies that I need, not just your groceries?
I love that. That's a great point about your prescription refills. And Dr. Winneke, as you think about our pregnant patients out there, or moms, et cetera, what do we say to them? Are they going to present differently or have different sort of warning signs than what they're used to?
I don't think they're going to be different, but they could be different than a non-pregnant patient. But typically a pregnant patient might not have some of that reserve. You sort of mentioned the lung functions a little bit earlier, but we find pregnant patients can get out of breath a little bit easier, certainly sort of more impactful with this cold weather. But I think another thing for pregnant patients is just they don't have that reserve. They also tend to be a little warmer, and so they might not recognize that need to bundle up quite as much because they're going outside already hot. But just remember to stay warm, but basically probably stay inside would be the best recommendations that we have.
Jessica.
That is it, Dr. Stites, for questions from the community.
I want to thank everyone for joining us, and the reporters who are online and listening in today, and for our community who are listening to those questions. I want to thank our team who kind of helped us put this together at the last moment, especially our media team here at KU. It's been a great and an important conference. Let me just ask people for some final thoughts this morning, and I'm going to start with Dr. Calendar Rich online.
You know, I think the key here is to think ahead and to be smart and to not do anything you don't have to do. We all have the opportunity to stay in, hopefully, and we should do the best that we can.
All right, thank you. Dr. Wenneke.
I'll echo that. Stay inside. It's a great weekend to nest. And if you do need to come in or have questions, just think about heading out a little early. Again, with those roads that could be slick, take your time, get good footing, and just be safe this weekend.
Dr. Wilson?
Agree. Yeah, we want you to be careful about falls. We want you to use heat sources safely. If you do have to drive, take it slow. We see a lot of car accidents, and stay safe out there.
All right, thank you. Dr. Slater?
Echo, stay inside, but if you have to go outside, make sure it's for short amounts of time. Make sure that your hands and your feet stay dry and warm. You've got lots of layers on, and if you do see signs that you've developed frostbite, don't wait to come in, because the treatment works the best the sooner we get it going.
Thank you. Dr. Wilson. I did it again 2 times today.
It's the hair.
You know, I think it's the hair, and I think it's my age. Who knows? All right, Dr. Lewis.
I would say no pediatrician's going to have much of a concern about screen time for the next few days. Stay in.
And get your prescriptions filled. All right. I just want to say thanks again to all of our audience. I like to often say at the very end, live long and prosper. I mean that, especially as we face this cold weather event. You know, go outside and have a little fun in the snow. Go for it. Know your boundaries. Know what you can and can't do. Know your health. Make sure you're prepared. Stay hydrated. Stay safe. And most of all, we want you around for the next program we run and the next major virtual news event. So thanks for being with us today. We look forward to seeing you soon. Enjoy the snow, but stay safe and stay warm. We'll see you soon.